Okay, so I'm absolutely delighted to bring on our guest for today. So we have Professor Martin Knapp, and he is Director of NIHR Research Programme for Social Care. And for anyone who doesn't know what the NIHR stands for, that's the National Institute for Health and Care Research. Now, I'm absolutely excited for this because research in social care, I know it's been going on in the background, but I just think there's so much more fertile ground within the sector to do more research on the whole nuanced side of care, whether it's from residential to live-in care we were talking about earlier, to lots of different areas and specialisms like dementia and neurodiversity. So it's great to have Martin on here and to ask him some questions about the research that's happening, what's coming up, and also how providers might be able to get involved. So it might be that you want to explore an issue within your care service and you want to know who's doing some research in that area. Well, the NIHR is doing a host of research and always looking for people to participate. So you'll find out more about how to do that. But first off, I just wanted to bring Martin in, and I'd love to know, Martin, a little bit about yourself, how you got involved, and the work that NIHR is doing at the moment. Thank you.
Thank you very much, Sophie. I'm delighted to be here. So let me say a bit about NIHR. So it's the research part of the Department of Health and Social Care in England. It has a very generous budget, I would say, for research. And it funds research in healthcare, in public health, and in social care, as you said. It's NIHR's 20th birthday this year, so we're drawing lots of reflections together. It's always funded social care research, but it's put much more emphasis on that in the last few years. So it's got a higher profile. Social care's got a higher profile within NIHR. And of course, prior to NIHR, the Department of Health, as it was then, and other names, always funded research. We've always had it there, but I think we've never had such a strong commitment to research in this field as we do today. For my part, I've been a researcher in this area for very many years, all my career. Since I stopped being a student, has been in social care or related fields, and I love it. I find it intellectually very engaging. I feel it's a very important sector, so I'm delighted to have this role I now have in NIHR leading this research program.
Great, thank you. And what are the things that the NIHR is doing at the moment? What's the main research topics that you're involved with right now?
So let me just say quickly, the NIHR does sort of three main things. One, it does fund research. I'll come back to that in a moment. Secondly, it also supports people to develop their research careers. So there's something called NIHR Academy, which is supporting individuals. And the third thing it does is to provide a sort of infrastructure to support research happening. So that's to provide support providers, support individuals participating in research. On the research program for social care, which is in that funding research area, what we do is we fund research on children's social care and adult social care anywhere in the UK. So we're interested in any topic in those fields. We have a very, very wide range of things that we're funding through our program. There are lots of other bits of NIHR that fund social care research. And I think probably you could think of a topic and there probably is a research study going on that topic somewhere. I think what I'm finding particularly pleasing at the moment is two or three things, really. One is we are embracing the rapid changes in technology-enabled social care and trying to do research in that area. I'm not a technology expert at all, but we're very keen to be funding research in that area. Secondly, we do try to, and we do succeed in following government policy and trying to respond to that. So we're funded through a government department, we're funded through taxpayers' money. It's very important that we therefore commission research which is answering questions which ministers, officials, the public want answering. And then thirdly, there are other bits of DHSC, particularly the health side. And so what we try and do is sort of dovetail what we do in with what the NHS is aspiring to do. So the 10-year health plan gives us an agenda for that. So lots of things we're doing.
That's really helpful to understand, especially the fact that you are trying to focus your research on actual questions or issues that are happening on the ground. So things that the department needs to know, things that care workers or providers need to know. So that's really helpful. It's not just coming from like a top-down perspective. I'm going to bring in Kat and Obi now to see what other wonderful questions the rest of us have. Kat, I know you had a question about funding, maybe?
Hi Martin. Nice to see you on here. Thanks for joining us. And yeah, I just wanted to say that I've had previous experience with the NIHR. I always want to say, by the way, NHIR. I'm probably going to say that the whole way through. But I've had some experience with trying to access the funding. And actually, I didn't get the funding because my supporting council actually pulled out the day before because they didn't have the staff resource, which is hugely frustrating. But as we know, social care providers are some of the biggest innovators in the social care tech space, digital platforms, creating the solutions that we know will bring positive change, reduce the reliance on commission services, etc. But the bit that I struggle with is I know that we can apply for the RPSC, but we need to act as a sponsor. And I think the reality that a provider has to have a sort of a university or a council partner is making it quite restricted for us as providers to be able to access funding. And one of the most common themes we have is that councils don't have the resource or the time to support us with applications. We also get the concerns that if they do support an application, then it would look unfair to the marketplace. And it might be deemed that even though we are innovating, and I always say, well, they're not doing it. So why would it look unfair? But we're constantly faced with it will look like that you are one of the preferred providers if we run projects with you. So it's very restrictive. Because we have to rely on having one of the councils or the universities as partners. So I'm just not sure what advice you can give us there, Martin, because I do feel that the system is built around the universities and the councils, and it's not really built for purpose for us to be able to come forward and access that independently, which causes unnecessary restrictions and also then prevents really positive innovations that could be coming into the marketplace, which have all been self-funded to date by our providers that have personally invested, etc. And then we do get that sort of that issue. So yeah, I'd love to hear your thoughts on that, Martin.
First thing to say, I mean, I think what we would love to have, what the research commissioning process would love to have would be the opportunity to find out about those innovations and to look at them and see whether they can be beneficial. How beneficial are they? How effective are they? Can they be generalized? Can they be scaled up? Can they be used in other places? So that's really important. I said earlier that NIHR's got these three bits. The infrastructure bit is there to provide support for people who are either wanting to do research or are doing research. So the two bits that I would particularly recommend. One is called the Research Delivery Network, the RDN, and what they do is to support people who are doing research or want to get involved in research. And that's not a sort of marriage broker sort of part, but they do help researchers find people or organizations or providers to participate in research. And then there's the Research Support Service, RSS. And what they do is if you've got a research idea, you can talk to them and they will then give you advice, free advice, to say, okay, this is what we think you should do in terms of positioning yourself. You might want to go to this particular part of NIHR or some other funder. You might want to have a partnership of this kind. RSS can sometimes provide funding for you to get public involvement, so get the views of people with lived experience to help you build a research proposal. So there are bits of the infrastructure that would help with that. What I would say just quickly, as from experience of sitting on research commissioning panels, is I think people often come with really good ideas, but they don't have the background in doing the research to know how to design the research study. maybe not to go to a local authority for the reasons you say, but if you can find a research partner in a university or in a similar organisation, I think that would be really good. The RSS would help with that. I don't want to inundate it with lots of emails, but you could email me, and I'm happy to sort of say, okay, given that topic, this might be a good, given where you're located or given your topic, this might be a suitable partner. Because, and I'll say this and then finish my answer, I think from the researcher perspective, one of the biggest challenges that researchers have is finding the places to do the research. So having a provider who's really keen to participate in research is a wonderful gift. So we need to find a way of then, meeting your needs with what the research community and the research funding community need in order to make them a good partnership.
Yeah, and I think for me, the way I thought, and this is me, I like to fix problems. Martin, you'll learn this throughout the course of this chat. So for me, what I thought would have been really useful for the sector as a whole, because I know we've got the funding committee, etc. And again, that made me ask more questions, like on the ones that are on the funding committee, have any of them worked in care? Have they had any sort of frontline experience on what the problems we're trying to solve, or are they all academic backgrounds? Again, so I was quite interested to know about that. But for me, I quite like the idea, like you get with innovation funding and other projects, that we had like an ecosystem, like a piece of software where I, as the innovator, who is a social care provider, would put through my innovation idea. And then the researchers would be able to look through and see what innovation ideas are out there, and they could match up, with innovations, and the members of the public could see innovation suggestions, and it sort of become a little bit fairer to the marketplace. Because I'm also very aware that where we have universities and councils, they can work with a small cluster of people that they're used to working with, and it is quite difficult for new innovators to come into that space to try and build those relationships. And again, I thought if we had this sort of system where it was more open and honest, it would scratch out some of that and make sure we're not missing any really, really good opportunities for people like myself who love to innovate, but I just can't get in. I cannot get in to get funding at all. Even with the support of the university, I had Plymouth University back and support me, but we still needed the council. And then me and the university was screaming for the council. And like I said, it all come down to time and resource. But again, if another council up country seen that innovation and they were like, wow, yeah, we want to capture that, they could have been sort of matching with us to just make it more of a fairer process. And I know that's not how it works now, and we don't find out who gets the money until they get awarded it. But I just think it's an opportunity, especially for the social care market, for it to be a bit more sort of open and public-led.
So there's lots of good points there. So just quickly, in terms of our committee and our process, so we have on our committee, we have people who are university-based, who are researchers. We have people with lived experience, either because they draw on social care support or they're carers, family carers or others. We have practitioners, and all of our proposals, every proposal that comes to the committee gets looked at by those different groups. I would say the practitioner voice is, no voice is more important than the other, but the practitioner voice is really important in giving us that sort of reality check. This is a very interesting study, but actually it's not that pertinent to practice. Or this is a really interesting study which is not quite perfect, but actually it's been really powerful if it would go forward, because it would inform practice activities on a day-to-day basis. So we're very keen to have that. The voice of the public voice, if you like, the people who draw on support, people who are carers, those voices are also really important too. So we take that very seriously, both in terms of the committee and in the reviews we get. And then when we look at our reports that come in, we also get those different voices to look at our reports. So we're trying to learn from that loop. So we do try and engage that. I'm sure we could do better in all of those things, but we do try and have those different voices. In terms of innovation, the other thing I would mention within NIHR, one of the programs is called I4I, which is Invention for Innovation. Now, most of their efforts, when I look at what they do and the conversations I have with them, they're interested in big pharma, big tech, and those sort of areas. But in principle, they're interested in anything which is innovative, which would improve healthcare, social care, or public health. So again, I think it might be worth trying to find a dialogue there. I'm happy to act as a broker for you, and the research support service would help in that way to try and find that match with, you've got these ideas, you're wanting to get those ideas researched, and then maybe generalized to the rest of the country. Well, what NIHR can do is try and find a way to help you to get that research happen and to make those connections in other parts of the country so they can be generalized. I mean, the other thing I quickly to say is, when we're looking at research proposals, if it's one provider and one university working in one locality, that might be really, really looking encouraging. But what we'd like to see is actually more localities being involved. So your aspiration to do something more broadly is exactly what we would see as well, what we would want to see.
That's really interesting. And I think the idea of the research delivery network, where you've got a group of people who might be able to just support and fill people through, like how they ask those questions, answer those questions that Kat was talking about, could be really useful. And I've been taking notes. There's lots of parts of support, I think, within the NIHR that maybe people aren't aware of, which could really help be a springboard for organisations who want to do more. The idea of getting more local authorities on board, or just throwing the net out a bit wider if you don't have anyone locally who wants to work with you, I think is a really good idea, and I think that could be quite supportive for the sector. So that was really helpful, and I do get the point as well about having someone with research knowledge as part of the team, because it's really difficult to write something from a sort of academic or research institution point of view than how you would write it for just without having to be part of the research academy. There's certain, I don't know, rules, sort of ways of like writing things and bringing things forward, which are quite complicated. So it does help to have somebody who has that knowledge on the project. And I suppose it's, again, just reaching out to universities, which can be a bit tricky, but I suppose sometimes you can find people who align with you. But yeah, really interesting. Obi, I didn't know if you had any questions.
Yeah, I do actually. So when I heard you were coming on, Martin, I was really excited because I was having a conversation earlier in the year with a carer who actually works with the Care Workers Charity. And she said to me she's interested in research, and she actually contributes to research at the moment. But she said to me she doesn't really know how to approach it, how to begin. So I'm asking, she hasn't obviously asked me to ask this question, but I'm asking on behalf of people who are interested and who possibly maybe aren't providers, because within the social care ecosystem, we've got providers, we've also got carers as well with aspiration. So if there's a support worker or a carer or someone out there who is currently maybe studying at university and they have an interest in research, what advice would you give them? What's the pathway, and how would you encourage them to what would you encourage them to do?
So what I would say, so as I said, there are three parts to NIHR. The one that's concerned with capacity building is called NIHR Academy, and they have a whole range of schemes which are there to develop the research careers, research skills of a whole range of people. And there are schemes specifically targeted at people who are practitioners rather than are established researchers. So they are schemes to support people who may be, working full-time in a practice role in healthcare, public health and social care. That person might want to develop some research skills and work as part-time research. They may want to make the transition to a full-time research role at some point. There's a whole range of different options. They might want to dip into research for a while and dip out again. But the academy is there to provide that support. And those schemes are, as I say, there are some schemes which are targeted at people established in the research community, and there are schemes, funding pots, which are for people coming from practice. And within those practice-facing opportunities, there are committees which are specifically focused on social care and public health, for example, rather than people having to compete with doctors and nurses and dentists who may have got more experience of being engaged in research, may have had more research training in their professional qualifications. So there is a recognition that people coming from the social care context, they're not treated in a special way, but they need to be recognised for coming from a different background and having perhaps different aspirations. So absolutely look at that. And then the Research Support Service, RSS, that I mentioned before, they would also provide advice to people that are looking to go into that sort of application channel. So if you're interested in that, the Research Support Service, which also has a specialist social care part, there are 2 hubs, so-called, which are social care specialists, and they employ researchers and people who come from practice backgrounds and others, who would then be able to provide, particularly guided support to say, you might want to do this, or you might want to do less of that to make your application stronger.
Martin, did you say that was the capacity building?
Yeah. It's called.
That's got 20% of the funding allocated to it. Is that right?
I don't know actually, but it sounds about right. But it's called NIHR Academy.
Yeah. And is that for students only, or is that accessible to providers as well?
Well, it's for individuals.
Yeah.
Okay, so it's an individual-led scheme. It's not for organisations. I'm not aware that it's been for organisations. There might be sort of team awards, but another player, an important player in the social care research space to mention is the School for Social Care Research, which is also funded by NIHR, and it's now its 18th year, I think. It's led from the University of York by Yvonne Burks, and I used to be the director a few years ago, and we did in that through the school fund partnerships. So I remember funding some work in Northumberland, for example. We funded some work in South Wales where we weren't funding the individual, we're funding a group of individuals working within an organisation who wanted to build the research capacity and the research awareness in their organisation. So I don't think I'm not aware of a program that does that right now. You're making me think I need to go and figure out what we should be doing in this. But I think if you talk to the RSS and the RDN, the Research Support Service, Research Delivery Network, they will provide some guidance on what steps to take. But I would just say, I'll repeat again, I think reaching out to universities, the good thing now with everything being digitally networked, you don't have to go to your local university. You might have very good links with them, but it might be a university in a very different part of the country, but you spot somebody or some group with the right expertise in terms of the topic or the development you want to make, and reaching out to them. I can speak for all social care researchers in saying, if a provider reached out to us and said, we're interested in doing something jointly with you, they'd be very excited by that, because, as I said before, it's hard for researchers sometimes to find that base in the provider sector where they can conduct the research.
And that's the thing. I go back to this sort of software where we'd be able to sort of match up with people, because I think that would be really nice, having it the other way around, where maybe the NIHR funded secondments into the care sector and it was sort of on the flip side. I think that would be really quite exciting, because it is really hard. I'll get students email me all the time, LinkedIn, Facebook, email me asking me, can I share surveys? They're doing a research document. I even had a student from Australia I did a 2-hour interview with a couple of weeks ago, all around the difference in the UK compared to the Australian social care system. And they've gone and dug me out. But again, I think if we had that platform where we're all aware, I'm a keen innovator in the social care sector, you're doing this space, it would be quite nice to be able to have that one-stop shop where we can get matched together. And because I find it really exciting, and the older I'm getting, the more research I want to do, which is really weird because I hated school. But as I'm getting older, I'm enjoying it more and more, and it does excite me. Because I did want to ask Martin in regards to sort of funding. I think when I looked at the NIHR figures a little while ago, I think since 2006, there was about 200, I think it was around 200 million pounds that had been spent, funded for social care research. And And obviously that was a really, really small amount compared to what was spent on health. And what is there sort of a cap on social care? What does that look like compared to the spend on the NHS to the care sector? Because as we know, we actually employ a lot more people in the social care sector than the NHS does. We're doing a lot more complex care, etc. I just was interested in what those ratios are now, and if there is a lean towards putting more of the allocations into the social care sector. Now we're looking to be a more sort of preventative system.
Okay, so lots of things there. So firstly, I don't know what the percentage is now, but I also know it is actually, it's not straightforward to say this is a social care study. So if you've got a study which is looking at infectious disease in a care home for older people, is that social care or is that healthcare research? So we try to describe our studies in a way which it makes, so we don't call health service studies in care homes social care, because that would be missing the point. So it's difficult to do that, but there's certainly no cap on social care research within NIHR. There are always huge competing demands for the funding that's there. Those demands come from the voices of people who use services, from carers, from provider organisations, from government ministers, from NICE, the National Institute for Health and Care Excellence, from other bodies, but want to see research evidence to help their decision making. So there's always a challenge there. What is really encouraging is that NIHR has, with setting up this research program for social care in 2023, and in continuing to support separate schemes within the NIHR Academy, NIHR is absolutely committed to fund social care research. It's the biggest funder of social care research in the UK. It works with other bits of other funding bodies, charities, research councils, and so on. So it's really committed to this. So it doesn't have a cap. It doesn't have a minimum either, I don't think. It just wants to see good quality research happening. What I would also like to see personally is, we see it happening a bit, but not as much as I would like, is social care research integrated into health services research as well. So quite often, health services research is going on, and some of the people that are participating in that have got quite considerable social care needs. Sometimes the social care part of their life doesn't get looked at in the research study. So if we do that, that would also be more useful.
Absolutely. Yeah, thanks for that, Martin.
I just wanted to delve into a little bit your research around dementia, because I think that there's a whole set of information that even the care sector hasn't delved into much. And I would actually like them to explore some of your research a little bit. So maybe you can pick out a couple parts of your research which you think give really interesting insights into dementia that the care sector might benefit from delving into. And also, secondly, what do you think that the sector does in terms of, do we understand the economics of supporting good dementia care? Do we understand that enough in the sector?
Okay, so I say my background is in economics, and I still do economics research. I try not that to be my only label, but I'm very happy to do that work. I think the economics evidence is really important. So decision makers, whether they're individual professionals taking decisions, whether it's individuals making decisions about how they use their personal budget, or ministers, those decision makers need lots of information to help them make a good decision. And some of that information could be economic information. So I think no apology for economic information being relevant. In terms of the work, so things that I do, I'm interested in dementia prevention. And so we're doing some work we've been doing some work recently, just finishing it now, to look and see how some of the efforts that could be taken in midlife to reduce the risk of dementia, what the consequences would be in the social care sector. So is there we know that the biggest cost of supporting people with dementia is in social care, bigger than in healthcare. So social care is more important. And more important than formal social care services are unpaid carers, family carers and others. So I don't think the research that goes into dementia reflects that balance of responsibilities sufficiently. I don't see more care research being done. Work that we've done doing recently, one I was talking about, there's an intervention, a service model called cognitive stimulation therapy, which works very well for people in the early stages of their dementia. Does not a cure in any way sensible at all, but it can help people to retain some of their cognition skills for longer. It improves their general health, improves their quality of life, supports carers as well. It works really well, but lots of people in the country are not getting it. And one reason might be that people live in rural communities and can't travel to those groups. Another reason might be that people are in communities defined by ethnicity or socioeconomic status where they think this is not for me and it's not suitable for me. So we're interested in how that type of intervention, that service model, which seems to work really well, could be adapted to fit the circumstances and preferences of different people in the community, and so it's more inclusive.
Can I just, before you go on, can you just explain what cognitive stimulation therapy is?
Okay. So what it is, it's getting people together. People, as I say, in the earlier stages of their dementia, they come together in groups. They may come with care, or they may just come on their own, or the carer might drop them off, and they have the discussion themselves. And they just take part in discussions. It's discussions led by a psychologist, clinical psychologist, who is then helping them. It's in reminiscence. It's helping them to engage. It's fun activities. It's meant to be a very collegial, very congenial atmosphere to help to stimulate the brain and help people with. It's not doing particular tasks, but what it does is engage people. And they have regular sessions over a number of weeks. I think it's 8 weeks is the standard service. People come together for a couple of hours each week. And they could be in care homes. People could be in care homes, could be in day centres, could be in other settings as well. And my cognitive stimulation therapy colleagues will probably tell me off for not quite managing to remember all the details. But it's that sort of, it's doing things which, quite often people with dementia are not very active, are at home. Their carers might be a partner, their spouse, their child, may be concerned about what happens if they go out into the community. And this is enabling them to get more engaged and to retain that stimulation which we all need to keep our brains active.
That's great. That's really good. Thank you for that. So that's one part of the research, which actually I think I'm going to look into, because I think that sounds really good. And then the other thing, and then I'll move on to Obi, was neurodiversity. So I did a conference on last week on neurodiversity and creating neuro-inclusive environments for people that you support. So like as an employer, how can you do that within your workplace? And I found that really interesting, and lots of things came out of that because I had people with lived experience. So is there anything particular? I know you sit in the dementia and neuro degeneration policy research unit. I don't know if those is connected. So I don't know if you can talk a bit about your research in that area, and anything that you might think is useful, especially in social care, to know about.
So firstly, there's a thing called the Policy Research Unit in Dementia and Neurodegeneration, which is not picking up on neurodiversity. It is looking at Parkinson's and ALS and other conditions. So in the neurodiversity area, so one thing we did recently, we worked with the Autism Alliance, which is the alliance of all of the charities, most of the charities in the autism field. And what they asked us to do was to help to identify economic evidence which would help to make the case for better service models to support autistic people and their families. And so we looked to find, where is there good research evidence, this service model, maybe for a family with a young child who's been identified as autistic, to support them in their family, their communication skills and their social engagement skills and so on. There might be good evidence on the effectiveness, it works, but the providers, the commissioners might be nervous about whether they can afford to do this. Is it something they can continue to afford to pay for? And so what we did was we found about 11, I think, service models where there was good effectiveness evidence, but there was no economic evidence. And so we just got the economic evidence together to say, actually, yes, you do have to put money up front for this to be delivered, but actually it's going to save money in service costs, or it's going to help carers get back to employment. It'll help autistic young people to make that transition from school into employment, and be good tax-paying members of the British public, and so on. So we're interested in those economic cases, and I think that it was a relatively small piece of work, but got lots of attention when we launched the report with the Autism Alliance. We had people from about 6 different government departments came along, including the Treasury. So it's just trying to get those messages through that there might be some good effectiveness, good effective models out there, but they don't have to break the bank. They are models which can be economically attractive as well.
Thank you. And I think we've got time for Obi, a question from you.
I'm going to make it really quick. So I was listening to you, Martin, and I was thinking about the providers that I interact with every day. So Kat's amazing, Sophie's amazing, but I would say they have had great careers, and they are in a position where they can actually directly work with people like yourself. However, try having this conversation with a small provider who is just trying to keep the lights on. I mean, lots of groups, and I see research questionnaires come in and there's no engagement whatsoever. I read it and I'm like, oh my gosh, this is absolutely amazing. The people who actually have the data, the people who can actually speak to the families they're supporting, they don't have the time. They don't even understand the importance of it, actually. So even sometimes I'm like, oh, we recorded a podcast episode and we spoke to this person. Even commissioners, give it a listen. They're like, do you know what? I'm just trying to keep the lights on. I'm just really stressed out. So they don't really understand the direct correlation between the work that's done in research and the everyday. But you still need them. With the cognitive stimulation therapy, when you were speaking about it, I was just thinking the amounts of people this could actually support from the provider community that I am involved in. However, getting into that, getting them to be involved, it's a bit of a hurdle. So I guess my question is, how could we make it more accessible? Because I don't think it's contributing to research. I don't think it's accessible. And when I mean accessible, I don't mean they understand what research is. Most of them are university graduates, but how it directly relates to the work that they do every day.
Okay, so I think there are 3 things to this. One is whether people want to do the research themselves, whether they want to participate in the research, whether they want to use the research. And I haven't said anything about using the research yet. Every research proposal that gets looked at by NIHR and other funding bodies, you have to put in, great idea, relevant question, good plan to do the research, good public involvement, all those things. And a key question will be, what's the likely impact? How are you going to take those findings? How are you going to involve people that could potentially use your research in the study to make sure that when you've finished and you're just writing up your report, it doesn't just sit on a shelf in the library, or doesn't sit in some obscure academic journal as an academic paper, but it's got the potential to have an impact in the real world. So every project gets judged in that way, and funded bodies really encourage people to find ways of communicating, which might be through podcasts, it might be through video animation, it might be through other things. It's also important to mention there's an organisation called Impact, which is at the University of Birmingham. It's led by Professor John Glasby, and it's funded to do exactly what I'm just saying. It's taking research findings and then taking them out there to the people, the organisations, the individuals who might use those findings, and finding ways to support them to understand the relevance of the work, the relevance of the findings for their work, and then to use those activities. So if you've not come across that, I would strongly looking at Impact as a beautiful website as well, and their role, so they get funding centrally to do their activities, and then they often partner researchers to then take on the impact activities, specialist activities, so that they're an extremely skilled organisation, lots of participation from providers, from commissioners, and people with experience. So they're doing that as well. I would just say it is very difficult for people to participate in research when, as you say, they're trying to just work hard to keep the lights on. And researchers sometimes are not very sensitive to the realities of the those businesses, those services, asking for information. But I think, again, I would just say, reach out to bits of NIHR that are there to support organisations, the research delivery network, and maybe they will be able to help in engaging across the different 3 areas I mentioned.
Brilliant. I thought it was helpful, Obi. Did you want to come back with anything?
Yeah. Oh, no. That's really helpful. I think all the signposts have been outlined, so just the listeners just need to just act on it, really.
Exactly.
That was clear.
Yeah, it really was.
I've got one more question before we wrap up. Is that all right?
Cool.
I just wanted to. So first of all, Martin, I just wanted to say I was really glad that you mentioned the unpaid carers, because as we know, they contribute, I think they say the economy around 160 billion a year. And I think it's so important that research and investment going into that research is pushed forward. And I know there's going to be massive barriers with that, because how do we do onward funding for something that currently is free? And I face the same when we're looking at preventative models, because they don't know how to cost it, because right now it doesn't exist. So I was really pleased to hear that the research is meeting the criteria and working towards solutions for unpaid carers. That was really amazing to hear. But I just wanted to ask you sort of a personal, an NIHR question about the Casey review in adult social care. And I just wanted to know what your thoughts were on what do you hope the end result will be of the Casey review for the research world, and what do you fear that it won't do, if that makes sense?
I don't fear anything. I mean, my fear is not what Baroness Casey and team will do. If I have a fear, it is that their recommendations won't get picked up by governments. We know that the Royal Commissions and other reports on how to fund social care in perhaps a more sensible way. I think we all agree the current model isn't the most suitable way to do that. There's been lots of good, sensible suggestions, but governments haven't felt they're in a position to take on those recommendations. They would need the implications of taking on the recommendations have in the past, and probably Baroness Casey's recommendations as well, will mean more spending. Maybe forever, but maybe certainly in the short term. So you need a government that feels brave enough and strong enough to take on those recommendations. So I had no contact at all with Casey Commission, and I don't deserve to have any contact at all. I don't have the expertise that she's looking for at the moment, which is understanding what's happening in people's lives, people who need social care support, what's happening when carers are providing that support, what's happening when care staff are delivering services. That's been her priority so far, and I think it's exactly the right priority to understand what the sector's all about. I'm sure at some point she will then, in her speech she gave recently, she mentioned research in there and the need for research to feed into some of the policy discussions. I'm sure she will engage more with research questions as time goes on, and I'm sure whatever she recommends at the end will provide an agenda for the research community to then latch onto. So it's really important. We do pretty well in this respect anyway. Researchers will say, this is what the policy community is saying, this is what's coming out of the sector, this is what people with lived experience are saying. These are therefore the research questions we want to address. So it's relevant research, whether it's coming from Baroness Casey or from the person down the road who needs social care support. We want to have relevant research.
Fabulous. That was really helpful. Great question as well. So we've put you through the mill, Professor Martin Knapp. Thank you so much. You rose to the challenge. Some great questions, but I've learned loads, and I think the sector will as well. And I think it will actually give us confidence to participate in research, because we understand a little bit better what support is out there and what you're looking for. And actually, we shouldn't restrict ourselves with the location that we are, or reaching out to universities, and actually just being a bit more bold around research, and those connections will hopefully organically come together, and we can present something that will be taken up and brought forward, and also to explore some of the great things that you're doing in your research, and the NIHR is doing to help our own services to have that impact that Obi was talking about. So yeah, that was really great. Thank you so much. I really appreciate that.
Thank you. It's great to speak to you and to listen to you. Thank you very much.